Hi guys, welcome back to my channel, and if you're new here, a big welcome. My name's Jenny, and on this channel I make mainly lifestyle content, which pretty much means I make videos about everything and anything, whether it's disability, chronic illness, mental health, physical health, Disney, fashion, beauty, travel, and pretty much everything in between. There's probably something for everybody, so I hope you'll find videos that you enjoy over here, and I hope you'll keep watching. So in today's video, we are now doing the second part of the video for Pain Awareness Month. Pain Awareness Month was in September, but I'm pretty sure this is going to go out in October, so apologies that it's kind of gone across to the next month, but you know, it's still really important to talk about. If you didn't watch the first video in this little series, then I'll pop the link below so that you can go and watch that one first, because it will probably make a bit more sense if you watch that one and then this one. But in this video, I am going to talk a little bit more about different pain management techniques, what people wish that kind of other people knew about pain, and what improvements that they would like to see in the kind of medical field when it comes to pain. So yeah, do keep watching, and hopefully there'll be something helpful here. I've got a few people to kind of help with this video, because I thought it would be helpful to kind of hear lots of different experiences rather than just mine, because obviously, you know, there's lots of different conditions that cause pain and everyone is going to have a different experience. So hopefully you'll find it interesting and helpful, and yeah, we've got a few more questions to talk about today. So the first question for this video that I wanted to ask was, how do you manage your pain? And I think this is a really important one to cover, because there are so many different ways out there that people manage their pain, and some things will work for one person and not for another, and it can be really, really difficult to find like pain management techniques. So I thought by having people talk about it, it might just give you some ideas if you're struggling to find like ways to manage your pain. And yeah, it's just interesting, isn't it, to hear how people kind of cope with chronic pain and acute pain. So I'll talk about my management techniques first. Right, so I'm going to start with like medical stuff, and the kind of medical ways that I manage my pain are with painkillers. So at the moment I'm on oxycodone, tramadol and paracetamol, and I take those regularly throughout the day. I started the oxycodone after I had my femoral osteotomy on my leg in November, and then I was taking the tramadol and paracetamol kind of before that. I'm kind of a bit stuck with pain relief, because most pain relief options I'm allergic to, so I can't take morphine, I can't take codeine, things like gabapentin and pregabalin I can't take, amitriptyline doesn't really help me. So when I went in to have my surgery, it made life quite difficult trying to find pain relief to send me home on. I do find pain relief helps. It doesn't get rid of the pain. For anyone that doesn't know, and if you haven't seen my first video, I have a variety of conditions, but I have Ehlers-Danlos syndrome, I have gastroparesis and intestinal dysmotility, and then I've had surgery on my leg as well. The different like combination of medications, I would say, definitely does take the edge off the pain, but it doesn't get rid of it at all. And I find that if I'm kind of really flaring up, I don't have anything else that I can take, which does make life quite difficult. I know some people have like pain patches and other different types of things, but this is kind of what I've been given at the moment. So I have those medications, and then I also have injections. So the main ones that I get are occipital nerve blocks, which are injections like in the back of your kind of head and neck. I get something called occipital neuralgia, which is like a kind of inflammation of the occipital nerve, and it can be really, really painful, but the injections do seem to help. So they're a mixture of steroid and local anaesthetic, and having those like fairly regularly does seem to make a difference to that pain. It does tend to flare up after the like injections to start with, and then I do notice a difference. I haven't been able to have those injections during COVID, and I'm massively noticing it, because the pain is getting pretty bad, and I don't know when it's like I'm going to be able to have the injections again. So that's a bit frustrating. I have also had injections in my back. I've had an injection in my wrist. that didn't really help because I've got damage in my wrist, but that didn't help that pain. So yeah, I've found like injections to kind of be of varying successes, but definitely the occipital nerve blocks are the ones that tend to help me the most. Other things that I've had to help manage pain are, I've had acupuncture, and that's through the NHS. I didn't even realise it was available through the NHS, but apparently it is. So I've had acupuncture and also dry needling. I think I found the dry needling more helpful than the acupuncture, although it did depend what I was having the acupuncture for. But yeah, I found the dry needling quite helpful for like muscle pain. So that's something that I would quite like to try again if I can. General physio can sometimes be helpful depending on what the pain is, and also making sure that you have a good physio that understands the condition. So things like stretching and sort of manipulation and things like that can be quite helpful, and also like water-based exercise, so like hydrotherapy, I find that can be quite helpful, although I do find like after I've had that my pain kind of then flares up, but while I'm in the water it can be quite nice. And yeah, I think those are the main like medical type pain reliefs that I get. So now moving on to the more like complementary therapies and things that I do to help. I really enjoy having massages. I haven't been able to have one for ages since I had my leg operation. The lady that I go to for a massage is upstairs and I can't get up the stairs, so I really miss having massages. But I do find that they just help relax everything, and also, you know, get out like knots and stuff, because I do find that my back is very knotty. So massages, if I could like go every week for a massage, I would do it, honestly. So yeah, that's helpful. I do also find having a facial helpful. I think it's just that relaxation, and when you're in pain all the time it can be very hard to relax, so I do find having a facial just helps me relax. And also I think because they like massage like around your neck and everything, and that's where I get a lot of my pain, that really helps. And then other things that I do, like just myself to try and manage my pain, I will use heat. So I've got like a Wheatie bag that I'll pop in the microwave, and I'll put that on various different parts of my body depending on what's painful. I have used ice, although I don't tend to use it particularly regularly. I just don't really find it that helpful. I mainly used it actually with my leg after surgery, because it was like so swollen. The ice did seem to help, and kind of I was more aware of the like coldness of the ice rather than the pain. So it might be something that I try, like, you know, at other times. Warm baths are really good, although unfortunately I can't have a bath at the moment because of my leg. I can't get in and out of the bath, so that's something I really miss being able to do for my pain. Just lying in a bath of hot water really does seem to help. Sometimes I just need to distract myself. If I really just cannot get on top of the pain, sometimes just, I don't know, putting a film on or listening to some music or something, just to try and get my mind off it for a bit. It's not easy when you're in a lot of pain to try and distract yourself, and when I'm in a lot of pain sometimes I don't know what to do with myself, and no amount of distraction is going to work. And then also using things like aids I think helps pain, because it means that I'm not doing stuff that's going to cause me a lot of pain. So things like using a wheelchair to go out, I would never be able to walk that far, and if I tried to walk it would cause a lot of pain. So it's kind of like putting in preventative measures so that I don't get to that point of being in so much pain. And it's taken a while to kind of accept using that kind of stuff, but now I kind of see it as the positive in that it's helping me to do things without necessarily getting into so much pain. So yeah, using like mobility aids and things like that is really helpful. And also just family support and like support from friends, people understanding my pain is such a big thing, because if somebody understands your pain then they might not necessarily be able to help you, but they can empathise with you and they can perhaps offer to help with practical stuff, or, you know, just kind of make a few allowances for you to rest, or to, you know, if you can't go out one time or something, just having that understanding, even if they've not experienced that pain themselves, just being there for you is a massive help.
I try to manage it with mostly supplements and medical cannabis, which is legal in Canada. Even recreational cannabis is legal in Canada, but the problem is it's not covered by the disability programs, which means I have to pay out of pocket. And because I can't work and I rely on social government programs, it's called Ontario Disability Support Programs where I am, I can't afford it. So I don't, it's by far the most effective medication that I've been on, and no doctors will prescribe the only pain medications that work for me. I can't take naproxen because I can't have non-steroidal anti-inflammatories, and they refuse to even prescribe Tylenol with codeine in it at this point. So I'm sort of left with, when I can afford it, I get cannabis oil, and I also, when I can afford it, get supplements, that things like magnesium, vitamin D, vitamin C, all these things that I'm supposed to be on for another condition that are also not covered. So yeah, the management could be better, but yeah, some other complementary managements that help though: stretching, meditation, heat. I take a bath with Epsom salt from time to time. When I can afford it, I go to physiotherapy. I have a mini TENS unit that I can use at home as well. Peppermint essential oil, putting that on sore spots, using it for migraines can take the edge off of a migraine almost instantly, so I use that as well.
In terms of managing my pain, I have various pain medications depending on how severe my pain is. I have regular intensive physiotherapy. I use a TENS machine to help target specific areas that are causing me pain. Warm baths are very good. Ice, particularly following dislocations. I have splints for my most problematic joints, and I also exercise. So one of the things that's really recommended for people with Ehlers-Danlos syndrome is to move as much as possible and in as many different ways as possible to help develop the muscles and help support the joints better.
I'm not sure we do manage, I'm not convinced. As I already said and showed you, I've got a hot water bottle that I use all the time. I've got ice packs as well, which I take out if I'm going out, because I need them all the time. I use ibuprofen gel, shoulders, etc. It does not get rid of the pain, but it likes quite good if I'm going to scream from agony. It's quite good. I've got heat packs that I take. They kind of work for 24 hours, and I've got some of those, which they're quite expensive though, but if I know that I'm going to have to do something where I have to be out for a while, I can't do it when I go to work, unfortunately, because I just can't afford to do it all the time, but like I've done some dance adjudicating this year and absolutely excruciating on my shoulder, so I just slap a heat pad on there to help me through, and my back as well to help me through the day if I know that. I've got really beautiful, what the heck do you call it, knee braces. Got 2 of those. I've got some compression ones as well, which if I happen to be not that bad, to kind of keep things in place but not like a full brace like that, I've got some of those. I've got this really nice heat blanket thing, which I absolutely love. I put it behind my shoulders and stuff like that. I think it's really good. It's just nice, it's just heat, it's just really nice. If I want to lay flat or something like that, I just need some niceness around my shoulders. That helps me. One of the best things I own, I have actually 2. I've got a chair and I've got a pillow. They're both massage things, like a massage chair and a massage pillow. It's shiatsu. So like they've got these little ball things in it, and they kind of go around and they kind of like massage you. And you've got heat setting and a normal setting. So I use that a lot. I get migraines an absolute ton as well, so I find these, they don't get rid of the migraine, but they definitely help you to cope. They're really good. I don't take any drugs for it. That's not that's not a criticism to anyone who does. I think people need to do what you need to do, really, because unfortunately I haven't found one that works for me and that doesn't have bad side effects and things like that. So I don't take anything. I just live with heat and ice and ibuprofen gel and massage pillows and stuff like that, and then do a lot of crying and whinging. So that's what I do.
I tried to manage my pain through physiotherapy. I tried that. It made my pain and fatigue worse. So for me, physiotherapy wasn't the route to go. I have tried many pain medications. None of them have worked for my back pain, which is what they were primarily given for. I have codeine, which ended up helping with my stomach pain, so I continually take that for that instead of my back pain, which is what it was originally prescribed for. Obviously, my doctors know now that I take it for stomach pain instead of my back pain, but it was originally prescribed for my back pain. I've tried many different medications over the years. I've been on lots and lots of different ones. Ones that aren't traditionally used and ones that are. None of them have had any significant difference at all. Many of them just increase my symptoms. I was on amitriptyline. I've tried amitriptyline twice on 2 separate occasions, 2 different years, and both times they have had no help on my pain, but actually made my fatigue much, much worse, which has negatively affected my daily life, which isn't great because it's meant to help. Sometimes baths can help if it's the right kind of pain. Lots of the times they just make other symptoms worse, such as dizziness and heart palpitations. A back brace does help with my pain on really bad days. It doesn't relieve the pain, it just sort of puts pressure on my back, sort of helps keep it in place so it's not really moving as much, so the pain isn't caused by joint movements at that point. It's just the pain that was already there. If I'm doing lots of walking, I'll be in a wheelchair. Things like theme parks I have to be in a wheelchair for, as I can't get around them and my knees will just give way and I'll just end up on the floor, which is not a fun time at a theme park.
I currently have Insoles, which are just tiny bits of plastic that go into my shoes to help my ankles. I find that one of my main sources of pain relief is heat. I am looking for a better pain management with my rheumatologist, but obviously because of the current pandemic, I had to stop seeing her, so I've had phone calls with her, but I'll be seeing her soon, face to face, and we're gonna try and go through some things.
So I personally, I do a little bit of both. I do some pharmacological management. I steer clear of opiate pain medications just because with EDS we are prone to constipation and opiates make that worse. Also, because I work as a nurse, I can't take those on a regular basis and be clear-headed enough to do my job. But I take some other medications for nerve pain and muscle relaxers to help sleep. I also do a lot of weightlifting. Weightlifting helps me to grow more muscle around my joints to help it in case. The more muscle mass I can put on surrounding my joint, the better luck I'm gonna have keeping them in place. So a lot of that, I do a lot of stretching at night, a lot of pain creams. I mean, anything I can get my hands on to, if it's new and it's out there over the counter, I've probably tried it for pain. You know, like all chronic pain patients, I have my favorites and my go-tos. You know, my Epsom salt baths on bad days, and we just make do. For me, a lot of my pain control is distraction. A lot of hanging out with my friends and going out and having fun in whatever way that may mean. If that's just reading outside for a day under my blanket and lots of pillows, then that's what it looks like. You just kind of make do.
My physiatrist is working hard at pain medicine management. I have done some physical therapy. I have started things like a TENS unit, which tends to help give me some relief. I do warm bath soaks, where I put a couple of cups of lavender Epsom salt in it, and it helps settle the nerves and the burny achiness that you get. It settles that down. I do a weighted blanket. Sometimes I am buried in that weighted blanket. And sometimes I use heat therapy from a rice padded heating pad. So the weight of that plus the heat can be good therapy.
Now the help that I've got, it's been up and down. I was on private healthcare, and then due to moving out, I wasn't on private healthcare anymore, and because it's a long-term condition, you can't get cover basically. And I've been under a consultant on the NHS, and I was supposed to be part of a pain management clinic in London, but because of COVID, those services are no longer running at the moment. So I'm kind of just figuring it out on my own. I have to take things like magnesium every day, iron every day, and then obviously with my other conditions, they kind of conflict with each other. So with my polycystic ovaries and all my endometriosis, I got diagnosed with PCOS when I was 14 because I had a cyst on my ovary that ruptured. Ever since then, which is now 9 years ago, I've had pain on my left ovary every month, and the pain that I go through when I'm on my period is excruciating. I am exceedingly heavy. I can barely move, get out of bed. I get upset stomachs. I have lack of appetite, or I have an increased appetite. I have extreme headaches. For a long time I was on the pill, and then I came off it, and then because I didn't like the side effects of it, it either made me put on weight, it gave me acne, made me very sad, it gave me suicidal thoughts, made me very anxious, just all of the things. So I came off of it, and then last year they were like, you need to have the coil, and I said I don't really want it because of my EDS. I've lost count of the times I've had to take myself to A&E because of my period pains and how much I'm bleeding. And the help that I've received on that side of things has been pretty non-existent. I'm now back on the pill. I'm waiting for surgery to diagnose me for endometriosis. I take things like milk thistle, again magnesium, iron. When I'm on my period, I take double iron because that helps with anemia. It's horrible. I have to take painkillers, but they don't do anything. They kind of mask it a little bit, but not really. The only real thing that help I manage my pain is, trying to take a paracetamol. I can't take ibuprofen because it gives me an upset stomach. Taking herbal remedies. I was having acupuncture, but that's not really a thing again now at the moment because of COVID. And regularly, like if I was able to have acupuncture once a week and an osteopath once a week and afford all the supplements I actually need to take, then I might be able to manage it. But being on a low income salary, living in London paying rent, I can't afford all of those things. So I'm kind of just having to wing it and deal with the pain.
So I manage my pain with pain medication. I have to take that every 1 or 2 days if I'm doing okay, but if I'm having a bad flare-up week or month, it'll be my 24-hour medication plus also extra Panadol and Nurofen on top. And I also have to manage it with physiotherapy and just being very careful with what I do.
It makes me feel really isolated. I often spend most of my days in bed, away from my family. A lot of the time it can make me really irritable as well, which means that a lot of the time people don't actually want to spend time with me. If I am to spend time with family or friends outside of the house, my pain often means that I have to just cut things short and leave a while before everybody else does. I have had physio in the past, and I do take those exercises with me. They are very helpful, specifically for pain in my small joints and my jaw. That's another thing to note. My most pain is in my hips, my knees, my small joints like my fingers, and my jaw, although it does quite frequently affect my shoulders and my back as well. And I also have quite a low level pain everywhere all the time, which doesn't sound that bad, but it actually can be quite exhausting. So yeah, I manage it with physio, and aside from that, it's just hot water bottles, rest, doing very, very light exercise, like movements, and being kind to myself as well is a big part. And taking baths. I don't have a bath in my house, so I just use my boyfriend's. I can use paracetamol for some type of pain or cocodamol, but I can't use ibuprofen because of my inflammatory bowel disease. It means that I'm at risk of bleeds, so that's not something that's possible, which limits my options a little less. I'm still kind of suffering some of the mental effects of not being believed by the doctors, so at the moment I'm not really comfortable talking to doctors about my pain, because I'm worried that they're not going to take me seriously, or they might think I'm like drug seeking. I don't know, I'm really not comfortable with it.
So the next question that I asked everybody is, what improvements would you like to see in the medical field with regards to pain? And this is obviously quite a big question, and there's a lot of stuff I want to say. Medical field is still quite limited, I think, in what they can offer, like pain relief wise, and there's new guidance coming out about, you know, the types of treatments that will be offered to people with pain, and it's quite scary actually to kind of have that prospect of not being able to get hold of, you know, medications and stuff that you know work, but there's still a lot of judgment, I think, about people who take, you know, like opioids or strong painkillers, and I would really like to see that judgment not be there, because, you know, there's not a lot of options for managing pain, and, you know, people generally aren't seeking out drugs, they just want something that's going to help them with the pain. And so I just wish there was a little less judgment, a little less stigma about being on strong painkillers. I know they're not ideal, but if it makes a difference between you being bedbound with pain or being able to function in a, you know, slightly more better way, that's really terrible English, in a better way, then surely it's like weighing up a balance between like quality of life and what you're taking. And there's just, yeah, as I said, there's just not a lot of options, and one big thing that I would love to see is just more research into pain and better ways of treating, especially chronic pain. It's just really, really difficult to get help. I'm really lucky. I've been referred to a local pain clinic, and, you know, they have doctors, they have psychologists, they have nurses, they have physios, and it's quite a multidisciplinary approach. And I wish that was more easily accessible and that there was more support from them, because although I kind of see them now and again, they have a limit, I suppose, on what they're able to do for you. And I just wish there was a bit more support available, a bit more funding for people with chronic pain, so that, you know, there are other options there that are kind of available to try, rather than just sticking somebody on medication straight away. Obviously, you know, medication is part of it, but I think having some psychological support, not because the pain's in your head, but just because having pain has such a big impact on your mental health, and you need someone to talk to, and somebody to talk to about managing daily life and things like that. And being able to see the right physios who understand chronic pain and understand the different conditions that cause it, and know about the different types of interventions that would help. I'd love to see more complementary therapies available for chronic pain, so things like massage, acupuncture being made more widely available, dry needling, stretches, tai chi, that kind of stuff, whatever it is, just more complementary stuff that would actually be able to help people. But yeah, definitely I think the main one for me is just less judgment with regards to medication, and for medical professionals just to understand a bit more about what it's like to be in pain 24/7, and why people will come to them at the end of their tether because they do not know what else to do. And that's probably why they want strong painkillers, because they don't know what to do. They've got no quality of life. And I know when I've kind of gone trying to get more, painkillers or injections and things like that, you just feel like you're fighting the whole time to be believed and listened to and to be taken seriously. So I just wish there was more support and more understanding.
Some improvements that I'd like to see in the medical field is doctors that are more understanding, that aren't as dismissive when you come to them with health problems, both when you have a diagnosis and they're like, oh, it's just this, you'll just have to deal with it, or doctors are also, I have found, because of friends and family members, that doctors are very fat phobic. They blame everything on your weight, and even if it makes no sense, they blame it on your weight. Or, they blame it on whether or not you're a man or a woman. Depends. If you're a man, typically it's, oh, you're just overreacting, you're fine, it's not that bad. If you're a woman, it's, oh, it's probably just PMS or your periods. And that's obviously an issue for men and women to be dismissed because of one thing or the other. Doctors who actually look at test results, and even if there's an abnormal result that they weren't expecting, like say when you get a blood panel, they're looking at maybe 1 or 2 numbers out of 12 numbers, and those 2 numbers are fine, but 3 of the numbers that they weren't actually specifically looking for are either way too high or way too low. A lot of doctors don't even care. They don't look at that, and that right there indicates that there could be a problem. And so more understanding. A better solution for pain management for people who can't have NSAIDs, and instead of this war on drugs, so people can access pain medication that actually helps them.
The medical field is a mess, in my opinion, with pain and just any syndrome that causes pain. They don't know about it enough. They have no idea. They don't know what they're talking about. There's just not that much research in it at all. No one cares. There's too many doctors that just think you're a young woman, you're just making it up. You can't be in that much pain, it's just your period, etc, etc, and it's disgusting. And it needs to stop, and it makes me really, really angry. And again, the habit of just like, let's throw some drugs at you, they don't like to say, oh, it'll make you gain 2 stone, oh, it'll mess with your kidneys, etc, etc. They don't like to say these things, they just shove them on you, and that's not right. Again, everyone has to decide for themselves whether drugs help them enough to like compensate for the side effects, and that's totally great if you know what I mean, that's great, but every person reacts differently to them as well, so it's just, but they shouldn't be throwing drugs at you before they've found out what the problem is, because again, just it doesn't make any sense. That needs to change. And I just think doctors need to be more compassionate as well. No one at my age wants to spend their life going to the doctors saying, my bladder hurts, my back hurts, my shoulders hurt, my hands hurt, my legs hurt, I can't walk, I've had a migraine for 2 months, so it won't go away. No one wants to spend their life going to doctor's appointments and being humiliated and prodded and poked and undressed and things like that, so people can look at you, and nobody wants that, not at any age, but especially not when you're young, alright? So maybe if they could just think, oh, this person's come to me maybe I could just, and they're in pain and that's what they're saying, maybe I could just be, a bit more compassionate and try to help them. People need to know what's wrong with them for their own mental health as well, because otherwise you're just worrying about what's wrong with you, aren't you, as well? And again, you can't take any preventative steps to make your life better, whatever that might be, whether that's diet changes or sleep or anything. You can't do anything until you know what's wrong with you. But yeah, we need more research, not enough is known about these things. And just, support as well. There's not enough support out there, there's just not. I don't even know what I'd want, but there just isn't anything. Just go and have some physio, take these horrible drugs. That's it. That's not support, I don't think they realise how traumatising it is to literally be in so much pain all the time. And something does need to be done about that. And I wish I knew what the answer was, but I think education is the place to start.
Improvements I'd like to see in the medical field with regards to pain is more understanding. Many doctors don't actually understand the pain I'm in on a day-to-day basis. I tell them it's a really high level of pain because that is the truth, and they just tell me my tolerance has decreased because I'm in pain all the time, or maybe I'm just exaggerating, maybe I'm just stressed. And I would just like there might be more research and knowledge about pain, because no one really knows what's caused it or how to fix it. It's just sort of, maybe this will help, maybe try that, this is our best bet. And so far nothing has worked, and that is not really very good at all, as it has had a really big negative impact on my life. And I know so many people have lived with it for so much longer than I have, and I can't think of what their lives have been, just constant arguing with doctors who just, when you know more about your condition than a doctor does, it just sort of feels hopeless. When you're sitting down in front of a doctor and they don't know what hypermobile Ehlers-Danlos syndrome is, it just immediately makes you think this is just going to be another wasted appointment. And appointments take time and energy, and they're really exhausting for me to attend. And it just really isn't productive, I guess, because nothing will ever come of it, because they just don't understand what they're trying to diagnose. Obviously, doctors are very intelligent people with wide ranges of knowledge, and they have to know so much about so many fields, specifically paediatricians who I've mainly been attending. But there just needs to be more research into pain, as there's barely any, as far as I'm aware, and everything that's been suggested at the minute has not helped me at all, and in some cases has made my life worse, which isn't great.
I want doctors to know that it's not just growing pains. Growing pains are very normal, but I was always in hospital with pain, sprained ankles, a broken ankle, broken fingers, countless things, and it's all just, you're clumsy, it's growing pains. They didn't look into it any further. It was literally just x-ray, oh, it's broken, cast, out. So I want doctors to know that there can be an underlying issue, and especially when I first started going to the hospital, when I started fainting, because I'm in college, they was like, oh, it's stress, it must just be stress. And that was extremely hard, because I started doubting myself. Doubting yourself is worse than anyone else doubting you, because you can't even trust your own head anymore, and you can't trust yourself. So I didn't know what to believe, but then I went to the doctor, and she was incredible.
When I was an ER nurse, I was constantly re-educating doctors and my nursing students, because they had this thing, they were like, well, that patient over there, they say their pain is an 8 or 9 out of 10, and she's sitting in there on her cell phone, and she's sitting there talking to her family, she's sitting there laughing. Honey child, if you have lived with chronic pain your entire life, that may be your coping mechanism. Chatting with family members, cracking jokes, mine's sarcasm, sarcastic remarks, reading, listening to music, playing on your phone, distraction. You have no idea what that patient's baseline looks like and what they live with on a daily basis. No idea. So I would like the way that chronic pain patients are treated to be looked at differently. I would also like there to be, I would like other forms of pain management other than pharmacological to be more widely recognized by Western medicine. Acupuncture, yoga, stretching, meditation. There's so much out there, and you tell doctors that you try these things and they're like, oh, that's so funny, as if it's a joke. But then if you go to them requesting pain medication, you're looked down upon. So it's kind of like, well, what the hell do you want me to do? Now, I will say that I think that if we can further regulate and legalize cannabis, I think that that is something that would absolutely help manage so many people with chronic pain. I went to college. I have smoked pot, and it was the best management of my pain that I have ever come across. I could still function, I could still be me, and I had way less pain. But unfortunately, where I live, it's not legal, and it's really hard to get a medical marijuana card. So I think that is something that definitely would help chronic pain patients more than a lot of things right now, other than more research.
I would like doctors to know that just because we come in with chronic pain seeking advice and help, we're not coming in faking and looking for an opioid addiction. We're coming in to find some relief to gain our life back.
With gynecological care, there needs to be equal amount of research that there is for any healthcare for men. Like, if men had to go through endometriosis or polycystic ovaries, it would have been cured by now, because men are seen as, more important in that sense, I guess. With EDS, there are more people getting diagnosed with it. There's more research going into it, but whether there's more support, not really, no. It's difficult, and it's especially difficult when healthcare professionals tell you that it's your anxiety and it's not your pain. It's very patronising when they say that, because, they don't know what you're going through. Some might experience those health conditions or other health conditions. They might be able to relate in some way, but the amount of doctors that I've seen that are like, oh no, it's not real, it's just your head, is so offensive, and it makes me feel like I'm going crazy. I also don't want people to diagnose me. I want my doctors to do that, and I want my doctors to treat me, but they're not. I feel like I'm very much on my own, and if I had money, I'd potentially be a bit better. Again, family, friends, that's the support network, that's great. Having therapy is also amazing.
Some improvements I would like to see in the medical field is that doctors pay more attention to children when they have potential chronic illnesses, because I found that because I was being diagnosed when I was 10 or 11, it was quite often put down as just me being a little bit dramatic as a kid, and it meant that it was very hard mentally for me to comprehend that I have a chronic pain condition when I was constantly told that it could just be all in your head, or you might just be, addicted to Panadol. Like, that's not something that a 10-year-old wants to hear. Just a lot more education done by the doctors in terms of childhood illnesses and disorders, and hypermobility disorders that can be found, and just believing children when they say that they are in pain 24/7.
What
I would like the doctors to know, or changes that can be made, is that physical health and mental health do play a big part in each other, but they're not the same thing. Although I do still suffer with mental health problems, I can really tell when a difference is I'm physically feeling something is wrong, or whether it's anxiety. And don't get me wrong, like anxiety can and mental problems can cause a lot of brain physical symptoms like headaches, shaking, heart palpitations, things like that. But I think you know when there's a difference, and I've definitely known there was a difference. And also I'd like them to believe women's pain a lot more, as I know a lot of men have not had the same experiences I have, and that might not be helped by the fact that I've had mostly male doctors. And also I think a big thing is young people's pain. They can sort of either not believe you, think you're exaggerating, or put it off to be growing pains, things like that, or stress at school, things like that.
And then the last question for this video was to ask them, what would you like people, so the general public, family and friends, to understand about living with pain? And again, as I said earlier, like, it's so important for people to have understanding. It makes a huge difference to how people treat you and to how they, understand what you're going through. So I guess I would just wish that, the general public and family and friends understood just how debilitating pain can be and how much it can affect your whole kind of body and life. So, just because you're in pain, it doesn't mean you don't also get crippling fatigue or really bad nausea or migraines and all these kind of different things. I just wish people could understand how complex it is, and it's not just pain, it's all the stuff that comes with it. I also wish people would understand that just because you can't see it, it doesn't mean it's not there. So looking at me, you'd probably never know I was in pain if I hadn't spoken about it. If I went out of the house, if I wasn't in my wheelchair or anything, I would probably just look like a completely healthy 30-something, and nobody would know any different. And I do find sometimes you can tell somebody what your diagnosis is and that you experience pain, and they'll come out with things like, oh, but you look so well, or you don't look like you're in pain. And it's like, well, what do you want me to look like? Do you want me to be rolling around the floor screaming? Because that's generally not what I do. When you've been in pain for years and years and years, you learn to hide it, and sometimes you do just want to scream and you want to cry because it hurts so much. And I wish people could understand that, and that just because you're not screaming and crying doesn't mean you're not in pain. I know a lot of people think that they just feel helpless and that there's nothing they can do, and I wish people could also understand that there are things that you can do, even if it's just being a listening ear or being a supportive friend, or sometimes it might be doing practical stuff, but sometimes it's hard to ask people to do that. So if somebody is going through pain, perhaps say to them, can I help with cooking a meal, or do you need any help with tidying or cleaning or things like that? It would really help to have those kind of offers, I think, because as I said, I would rarely ask anybody for help. So for somebody to kind of understand that is definitely something that would massively help me.
If I end up cancelling plans last minute or even well in advance, it's nothing personal. I am in so much pain that I can't function. And then other things are just because I've had a good day last week or even a good hour a few hours ago doesn't necessarily mean I'm going to have several good days in a row. It doesn't mean that just because I was okay this morning that I'll be okay this afternoon to do things. I may have to cancel all my plans because the pain just skyrockets. Alternatively, from the just because I've had a good few days where I've done a lot of stuff, even if I've had a day where I rest or several hours before where I rest, sometimes resting is necessary, and that, well, it's always necessary, but it doesn't mean that I will have enough energy or enough pain relief the next day or the next few hours to be able to actually do anything. So just some understanding. We're all trying our hardest, and we're not doing anything intentionally just because we don't want to do something, or we don't, something better came up. Most people with chronic pain only end up canceling because they absolutely have to. It's a last resort thing, and we feel guilty for it most of the time, and that's something that isn't fair for us because it's beyond our control.
Is that people can't really see it. The only visual indication is my skin, and I guess people don't necessarily realise that that's painful, and if they don't witness a dislocation or subluxation, they're often completely unaware of my medical condition and the pain that I'm in every day. Because the pain fluctuates, I can have days when I am incredibly active and then have days where I can barely get out of bed, and I often feel like people don't believe how much pain I'm in, and there's been times when I found myself trying to justify my pain to doctors and justify why I need help, and that can be incredibly frustrating. When my pain is really bad, it's difficult to focus on anything. It makes me incredibly cranky, and I could be having a conversation with someone and the words just don't go in because my brain is so preoccupied by the pain that is in my body. So on really bad days, it's like being cut off from the world because the pain just consumes you. And I don't think people have any awareness or understanding of what that's like because they normally only see the good days.
I think people think that they understand when they don't. Like, they think, oh, I've been in pain before, I broke my foot that one year, or I had a carpal tunnel once, or whatever. They think that they've experienced something which was painful once, and then that means that they understand what it's like being in pain all the time, and that's not the case at all. I'm not belittling or saying that they haven't been in pain in their lives, it's not been horrible. Of course, every single person has, but people don't really understand how much it grinds you down when that's how it is forever. Every single day, every minute of your life is pain, and that's what you can think about. You don't really understand how that I can't even describe it to you. People need to listen and let you speak, and stop jumping in and saying, oh yeah, I understand. You don't understand, alright? And that's fine. I don't expect everyone to understand. You can't empathise if you've not been through it, that's fine, but you can have sympathy, and that's great. In some ways, because people can't see what's wrong with you, they think that there isn't anything wrong with you, and if you do anything to the contrary of that, they kind of can't get it in their heads, and they just kind of, they don't like it, they don't treat you very nicely. So that needs to change. We need to stop thinking that because we can't see something that's not there. I just think the real thing is just that never assume anything about anybody, right? Never assume that someone is well because of how they look, how they're dressed, how young they are, how old they are. Just don't assume it, and just be kind to people.
I'm not lying about my pain. It's episodic. Some days I'll be fine, I'll be okay, I can sit through classes, it'll all be good. And then other days I won't be able to leave my bed. I'll have to sit there and just do absolutely nothing because I just can't do anything because breathing hurts too much. It's an awful illness to live with, and no one except you and other people in your community truly understand how you feel because they just have never had to experience it. They've had, everyone's had pain, but until you live with it every single second of every single day, you just don't really understand how awful it can be. My friends are brilliant. When I was first diagnosed, they researched it, they tried their best to help me, they were always ones giving me ideas and things, and they just do whatever I need them to do. If I'm having a bad joint day, they'll help me, they'll support me to my classes, they'll hold me up and help walk me to my classes, they'll carry my things if it's too heavy for me because I don't have much muscle mass anymore. because of the chronic fatigue and the inability to do exercise because of it. So they'll carry my things for me, and I think people just need to be kind to people with chronic illnesses, as they don't truly understand what it can be. Lots of people say, oh, it's not fatal, and they're right, it's not fatal, but it is, slow torture, really. That's what I've seen it referred to a lot, and it's not a lie. Just be kind and be as helpful as you can be. Ask them what they need, and specifically don't tell them to get well soon. That is the biggest pet peeve of mine, because I can't get well soon and I'm always going to be like this.
I want the public to know that not all disabilities are visible. I know that's a thing that's said a lot, but it's still not understood, at all. I am an 18-year-old person. I am seen as physically fit, and I walk without medical aids, or medical aids that people can't see, and they just think that I'm lazy from sitting down all the time, and that just because I'm sitting down doesn't mean I'm lazy. And if I'm laying down in public, I'm not just tired, or I'm not just being lazy. I'm currently unwell at that moment, and I'm trying to help myself become less ill. Everyone has something going on, and whether that be mentally, physically, emotionally, socially, anything, sometimes you can't see it, so you shouldn't judge someone by what you can see, because that's ridiculous.
I would like both the medical community, occupational community, as far as those who are hiring and firing for jobs, it's a whole multimodal approach to how we're expected to live with chronic debilitating illnesses and disabilities. We're expected to work full-time to pay for our exorbitant medical bills, but our jobs can't really wax and wane the way that our pain does, and about a way our abilities do. So many people with chronic pain and chronic disabilities are shut out of the job market. I would like all of these faces of this multimodal issue to practice more patience. I would like them to not immediately get annoyed or mad when I have to cancel last minute or I have to call out. I would like there to be better disability services that are more understanding and less accusatory, so that those who actually need those resources can get them. I would like my family and my friends to know that, yeah, I deal with a hell of a lot and I am so tired most of the time. But if I am here with you and I am using my spoons and I am expending my energy to spend more time with you, that matters and that's important. And I would like more people to kind of ask these questions and ask us what it's like to be us, and to recognize how we live every single day and how many challenges we have to overcome just getting out of our homes, just taking a shower, just getting out of bed.
I would like people that endure this to know, never give up. If you get a doctor that tells you something and your spirit within you says they're wrong, don't just give up. Keep fighting. When you're physically unable to do anything and you're in the bed, don't give up. You're not in this alone. I am fortunate enough that I have, my daughter is fantastic in helping me, not only emotionally, but sometimes physically, while she also battles her own EDS and her little girl's EDS. So we're in this together. My husband has been my rock when I beat myself up emotionally over not being able to do the things that I used to do or that I thought I could do. he reminds me that I'm giving it my all and my best. I choose what I can do and what I can't. It's okay to say no. It's okay to say yes and then have to turn around and say no, because we're constantly changing in what's going on with our bodies. Living with chronic pain is challenging. But I know that with a very good support group, physically, emotionally, we are able to do this. And my number one goal in this is to share my story, that it would bring awareness, that others around us would be more aware that just because I parked in the handicap aisle and I foot walked it into the store and grabbed a cart doesn't mean that I'm not disabled. And that we as a society need to understand that disabilities all look different, and sometimes they're invisible. I may put on some lipstick and do my hair and actually put clothes on outside of pajamas, but it doesn't mean that I'm not dealing with my chronic pain and my disability.
When I have a flare-up, it feels like I have like major flu and a really bad hangover. Obviously don't really drink anymore because my body can't tolerate it, and I just have to be careful all the time. I'm always worried I'm going to have a flare-up, and you know, it always impacts me, and I'm in pain all the time. I just kind of found ways to mask it, I guess, especially around people. Like when I was in an office, I would say like, oh, this hurts or this hurts, and people were like, oh, you're always ill or you're always in pain. I'm like, well, yeah. And you know, I've had people say that like I complain a lot, but I end up stop doing that. But it's like, why shouldn't I? Why should I have to hide the pain that I'm in just to make other people feel less bad? I don't want people's pity. I just want people to understand that I can't necessarily do as what they can do, or, you know, there's things that will affect me that won't affect them. Until someone experiences pain, they won't really understand it. I guess for them to kind of imagine, you know, if they've got the flu, or they've got a really bad cold, or just something that is painful to them, if they imagine what that's like to have every day. And even if they set themselves a task of being like, oh no, I've got this today, I've got this pain today, I can't do this today because I've got this pain today. Kind of putting themselves in someone else's shoes, and remembering not to tell that person to look on the brighter side or to think positively, because sometimes there's nothing positive to think about. Sometimes it's just getting through day to day.
It's not every single day. I don't struggle with it badly every day, and one day I might be running and the next day I might be not able to get out of bed. It's not a constant thing. It's always changing. It's always flaring up or going down, and I just really wish that the general public would know that it's invisible illnesses like this that aren't always invisible, but when they are, you need to not believe the people that say that they have an illness, because they do. It's just not it's not a problem, and it's not impacting them as much as it normally does. And so just being really respectful and knowing that if someone says I have a disability, they're not going, well, you don't look like you have a disability, because you don't know what happens behind closed doors, and you don't know how much pain they might be in at that moment. And yeah, just be considerate with people who have chronic pain or physical disabilities, because quite often they're not showing everything that goes on in their body and everything that is going on at that moment in their body.
I would really like my family and friends to know that it's not me being antisocial. It's not me being moody. It is very hard for me to carry on with the normal day-to-day life with the amount of pain I'm in, and I'm aware how much it affects my relationships, so I'm learning to treat myself with kindness. So if other people could do that too, that would be great.
So that's all the questions for this video, and that brings me to the end of my couple of videos for Pain Awareness Month. I really hope you found them interesting and helpful. If you're going through pain, or if you're not going through pain and you just want to understand more, I really hope they've been good for helping you to understand. If you have enjoyed them and you'd like to see more, please give me a like and subscribe to my channel. Also hit the notification bell. That means you'll get notified every time I upload a video so you don't miss anything. Leave me a comment. Let me know if you have any kind of pain, if you can relate to anything that I've said, or if you haven't got pain but you've learned something from the video, please do let me know, because that would be really helpful for me. Also, let me know if there's any other videos you'd like to see me do, whether it's about pain or chronic illness or disability or mental health or Disney or fashion or beauty or whatever it's about. Please let me know what kind of stuff you'd like to see, because it really helps me to know what you guys want to watch. Also, come and follow me on social media. My links are in the description below, but I'll put my Instagram and Twitter up here. Those are the two places that I'm mainly on, so please do come over and say hello, because that would be lovely. And I'll see you in another video very soon. Bye!